This is a very interesting scenario where age is not a determinant of what can be provided. It is actually the condition that the patient presents with. With the experience that I've had and training, my training extends from an ophthalmic background, and consequently I've been trained in pediatric, adult and the geriatric age group. We shouldn't refer to it as geriatric or the senile age group. This is an age group that presents with significant aging changes. However, look back at the pediatric age group, that presents from day one, when children sadly can be born with congenital deformities. And these are problems that I've learnt over the many decades of dealing with patients to how we can very nicely bring them back to be acceptable and comfortable with their peers. When we're dealing with the older age group, namely the 60 plus, this is no longer regarded as the older generation. These people, when they look at 60 plus in their parents, they were regarded as old. The 60 plus age group is really the new generation, and these people are looking at how can they look their best. Consequently, both function and appearance becomes a vital part in their everyday life. Even an 80-year-old may present to me where there is true reason to try and improve their looks. 80 is no longer, again, an old age group. These people may live another 10 or 20 years, though they wish to look their best. With the other age group that is a significant part of the functional and cosmetic group is the 20 to 50 age group. This again is a new age of how can I look my best, how can I challenge people in the community for the best opportunity of looking good, and also am I good enough for the job as a shop assistant or in other parts of the movie industry. How can I present myself in the best possible way? We always can help, but sometimes it may be just simple boosting their confidence by explaining to them that they are looking good and there's nothing that requires to be done for them. This is also equally important to explain you are perfect in your structure and in your form, and there's nothing further that is required to be done. However, you've got your other age group that does require a little bit of help. Within this age group, patients will present to me requesting for treatment. It is often important as the doctor, as the guide to what is most appropriate, to sometimes to tell patients you do not require treatment. It is not essential. In fact, it is detrimental to actually start a treatment regime. I also believe that it is wise on my part to tell patients, if they do go elsewhere, to be cautious, because additional treatment may be the beginning of a downward run rather than an upward run. It is vital to make firm decisions as to how are you going to best manage your facial and aesthetic appearance, because once function has been disrupted by some of the treatments, it is very hard to reverse a functional abnormality due to someone intervening at an early stage.